I'm Dr. Fritz at Root Therapies, and today I wanted to show an example of a great Japanese treatment for pain. This is known as the Whiplash treatment, which is part of a tradition started by practitioner Yoshio Manaka. And so it's a very simple, few needles, very little stimulus, and then we use ion pumping cords, which were created by Yoshio Manaka in World War II to actually help with the pain from burns. So with Japanese acupuncture, we use a lot of abdominal palpation. And so with the Whiplash treatment, you can use this just if you know the person has any kind of neck, upper back, or lower back pain. But then the abdominal signs are going to be the ASIS regions. And so we'll see if that's painful at all. Okay, so that gets a good pain response. And then stomach 25 will confirm it. Stomach 26. Okay, and then kidney 11 can also be palpated. But if you know that the patient has that injury, then you're going to know that it's going to be a good treatment for them. All right, so we're going to start with the sarin needles. And it doesn't have to be sarin, but for Japanese, you do need to use, very thin needles. And so I'm going to start with Sanjiao 5. Okay, we palpate the point. Okay, move your hand up there a little bit. And then you're going to do a right-handed insertion. And it's going to be really shallow. And then Sanjiao 5, we're going to connect to gallbladder 41 on the foot. And so again, no deeper insertion. It's not necessary to get that dachi sensation. The next extraordinary vessel, master, and couple we're going to use is going to be small intestine 3 and bladder 62. So we're actually going to start down at bladder 62. Okay. And then last is going to be our small intestine 3. And that's it. Now, a lot of times you want to tape down the needles so that the cords, these are the ion pumping cords, they're very simple cords, 2 clamps, a black and a red, that are connected by a copper wire, and they have a geranium diode in the center. And so with this, you want to have the master point have the black clip. And so it's a good idea to just let the patient know it's going to hold on to the needle. And so we're just going to have it kind of hug the needle there. Okay, so black, Sanjiao 5 to red, gallbladder 41. It's going to hug the needle. And then you do the same with black, bladder 62 to red, small intestine 3. So with women, we start on the right side of the body. And with men, we would start on the left with the master couple points. You do this treatment bilaterally. Some of the Japanese ion pumping cord treatments you do not do bilaterally, just do one side. With this, we would then let her sit. We do the same thing on the left side of the body. These usually would sit for about 10 to 20 minutes. And then you can come back and reevaluate how effective the treatment was through abdominal palpation, through a hara palpation again. So the same areas, the ASIS, stomach 25, 26, and see if they're less tender than they were. And then you know that the treatment is going to be effective. Thank you.